totally disagree. Okay.
Thank you, Mr. President. The Vice President, in his remarks, was talking about the federal efforts that have been undertaken as it relates to nursing facilities. And as you both know, they've been just so incredibly hard hit, just tragic, over 10,000 COVID-19 deaths so far. The industry says that they're struggling as it relates to testing. Can you commit to increasing testing at the nursing facilities
Well,
across
we're
our
doing that
country?
automatically. I mean, that's almost common sense, but we're doing that automatically. I mean, you look at the state of Washington. That was our first glimpse of it. They got hit so horribly in that nursing home. It seemed like everybody was from a particular nursing home. So we knew immediately that was going to be a problem, and we're doing that 100%. We're taking very special care of our nursing homes and our seniors, other than me. Other than me. Nobody wants to take care of me. But other than me, we're taking care of our seniors.
Another area.
please, Mike.
Thank you, Mr. President.
No, it's just an enormously important question. And we want to thank the American people who have been putting off visits to their grandmothers and grandfathers and moms and dads. It's tough. I'm going to be in Indiana next week, and I'm not going to go see my mom. She lives in her own home, but people get it, that the risk of serious illness for a healthy American of the coronavirus is fairly low. You'll either have flu-like symptoms or no symptoms at all. But as we've said so many times at this podium, and the American people get it, a healthy American could inadvertently convey the coronavirus to a senior with an underlying health condition and have the kind of heartbreaking results that we've seen in nursing homes around the country. It's the reason why from early on, the President took decisive action to raise the infectious disease standards at every nursing home in America. He deployed all 8,000 of our inspectors, the Center for Medicare and Medicaid Services, to dedicate all of their time to ensuring compliance with those new higher standards. We've spoken about nursing home issues with governors around the country, and frankly, there are governors around the country that have done remarkable work with nursing homes. You mentioned Governor Brian Kemp. He actually used the National Guard in Georgia. He deployed them to nursing homes to do cleaning and to disinfect areas of those nursing homes, and it's tremendous service. But to your point about testing, if you look carefully at the guidelines, Open Up America again, you will see that in phase one, the level of testing that we contemplate is first that we want to be able to test anyone who has the symptoms that may be coronavirus and be able to test them quickly. Secondly, we want to do the kind of contact tracing, and Dr. Redfield and his team are deploying CDC teams in every state in America to be able to find out everyone that that person has been in contact with and test them. But if you look right underneath that, what we're directing states to do is be prepared to deploy testing resources first and foremost to nursing homes and long-term care facilities so that we can monitor any potential outbreak of the coronavirus among the most vulnerable population. Thanks to the leadership of our Surgeon General, as the President announced today, we're also going to be deploying testing resources to vulnerable communities, to underserved communities. The CDC released new preliminary data on the impact, particularly on African American communities in this country, and it's the reason why part of our phase one recommendation is that we deploy testing resources into those communities that are described by the doctors as socially vulnerable. And even as we speak, we'll announce next week that we're already in the process of deploying testing. And so it's a good opportunity to remind every American to be especially careful around our seniors, to heed the guidance about avoiding visitations, to protect the health of those who are most vulnerable. But the American people can be assured that from phase one forward, all the way through phase three and reopening, we're going to be helping to guide the states to focus on the most vulnerable, beginning with our seniors with serious underlying